The main thing is it's important to go through all the options with the patients before they get the lens implant, because you don't want a situation where the patient comes back to you and says, well, my friend or my relative got this lens, you didn't tell me about that. So they need to be informed so that they can make an informed decision about what lens implant is going into their eye. So the buzz in the community lately has been a move from an outpatient surgery center to the office for cataract surgery. So we don't know what that might look like, but eventually there might be a suite in ophthalmology offices for surgery. So while we always pre-plan the eye is still a biological system. It's going to heal the way it's going to heal. And so minor shifts in the lens position can sometimes affect the need for a patient's need for glasses after surgery. So monovision is also another setup, which you can do with standard lenses, where you leave one eye undercorrected for reading and you leave one eye corrected for distance. So if a patient is used to monovision naturally, if they had monovision in their glasses or just have monovision naturally, those patients are good candidates for monovision after surgery. It's not for everyone.